All right. Well, my name is Larry Hernandez, and I'm with On Point Movement Performance. And today I have a guest. Her name is Laura Plummer, and she is one of the PTs that works for me, and she's been working with me for a good while. And we decided we just want to do a podcast just to kind of spotlight who she is and what she does, and just kind of talk to her a little bit about some of the things that she does with her patients. She's been a great employee, and so. Yeah, with further ado, this is Laura. And so I guess my first question, Laura, is just what made you decide to be a PT?
Well, my mom's a PT.
Okay.
So I've always kind of been, around the PT lifestyle, and we've always been, healthy, active. She's put in a lot of work to kind of make sure that we were really active throughout our lives, and I've just seen the changes that have come out of that. And I've always been really interested in the anatomy and how the body works and things like that as well. Um, but yeah, I got my degree in exercise science, and then I decided I wanted to go to PT school after that. And yeah, it was a good choice. I really enjoy what I do.
Awesome. Yeah. Is there any certain I guess, story you can think of, or just maybe um, maybe something you decide like, where's it one big impactful story? Like you said, your mom and yourself just have seen the benefits of health. What kind of things have you seen, I guess?
Um, so yeah, I'm close to both my grandmas. One grandma is no longer with us, but my grandma who is with us still, she's in her mid 90s and she still travels. She still does all the stuff she wants to do. She still goes to exercise classes, but she's been really active throughout her life and really taken care of herself. So I've kind of seen firsthand how just staying active can really help with the aging process.
Awesome. Well, my next question is just what makes you different? I know one thing, obviously, I could probably say, but you can elaborate on it a little bit, is it board certified vestibular or just certified? I don't know what the terminology it is.
Yeah, it's a certification through the American Institute of Balance.
Okay. And yeah,
Mhm.
tell me a little bit about that. Like, what do you do differently as a certified vestibular? Because I think in school and then even myself, I've gotten some light education on vestibular, but you've chosen to specialize in it. And so, what does that look like, and how's that impacted your treatment, I guess?
Yeah, so yeah, we got a little bit of it in school, like maybe a week's worth, so not very
Yeah.
much.
Yeah.
It was all kind of crammed in there, so I didn't think that that would ever be something I'd want to get into. But when I was on my clinical rotations, I had a couple of clinical instructors who saw a lot of that population. So patients
Mhm.
with dizziness, vertigo, wanting to work on their balance. They've had falls in the past or outpatient level, multiple sclerosis or Parkinson's disease, post-stroke. Um, I didn't know much about it, but then on clinicals, I was like, wow, this is really cool.
Mhm.
And then at my first job, we got a lot of referrals from the doctor who worked next door because he didn't know much about it. He knew it was something that we could help with,
Mhm.
and he was happy to let us help people with it. Um, and so I gained a lot of experience at my first couple jobs just with that whole population. And it is something that really kind of affects everyone. So your vestibular system, as you get older, I think starting at age 40, it can start to decline. So it's
Yeah.
something that I think we need to do a better job of incorporating early
Yeah.
because once people get older, your muscular system, we start to lose muscle mass as we age as well. And it's not necessarily something that we can't address. It's just right
Yeah.
now we don't.
Yeah, yeah.
So,
I mean,
yeah.
I notice myself like when I do spin my daughter when she's like spin me, I get so dizzy now compared to like when I was in my 20s, you know? So yeah, I could see that.
Yeah, and I think it's more just getting the information out there and letting people know about it more. Because I think right
Hmm.
now people just attribute it to age
Yeah.
and they're not like, oh, this is actually like something I can get help with.
Yeah.
But the training I got, so so the American Institute of Balance is in Florida. I think it's actually an audiologist who found, built up the company, but he's been doing it for decades and decades, has a lot of PTs on staff who help him with research, help him see patients, help him teach all of these workshops. Um, and it's just a really good um, way to get education in a way that can help with clinical education.
Yeah.
So I knew right away, I kind of researched a couple different options, but I thought for seeing patients, that was going to be the best way to really just get information, get experience, and then be
Yeah.
able to apply it really quickly.
Yeah. Awesome.
Yeah, and then I was originally certified in vestibular rehabilitation and concussion management, but then I decided to go ahead and do the advanced vestibular rehab certification just because I had enough experience that I felt confident um, taking that step.
Yeah. Yeah. That's awesome. Man, you went through a lot. A lot of studying.
Yeah, yeah, and
Yeah.
it's kind of nice because they do require you to recert every other year.
Yeah.
So they have research articles that you have to read and then take a test on. So
Hmm.
it's a good way to stay up on, what's going on in
Yeah.
that area.
Yeah. Yeah. That's awesome that you've done that because like I did the same thing with like shoulders. I tend to specialize in
Yeah.
shoulders, and so I see a lot of shoulders. You market a lot of shoulders here at the office, and I took some special certifications too. And I work with a lot of PTs, and some of them will come in, and you just have a different approach to something you've specialized in, and I think you have that, and so you're more effective at it. So that's awesome. So like I think you mentioned some of the type of people that could be affected by this. But like, how would you summarize it? So you said some just people over 40s, just in general for preventative. What do they look for, I guess, themselves
Uh,
if they decide like, hey, I might need this?
Yeah, I know, there's certain types of environments, like actually, what you were talking about, just, spinning around, that can
Parents,
really,
parents,
yeah,
yeah,
parents, and then even people who notice they have more difficulty, like walking on uneven surfaces or in dim lighting,
hmm
or they've noticed that they do feel more unsteady, or they've had, a recent trip or recent
hmm
fall without injury. Those would be good times. And then certainly if someone has fallen in the
Okay,
past, like that's
okay,
something that's good to get checked out.
yeah,
And then, yeah, and if with patients who are, 65, 70-ish, that is an age where people are statistically more likely to have kind of develop vestibular dysfunction conditions. So types of vertigo,
hmm
and types, BPPV, I'm sure you've heard of that.
yeah,
So yeah, that's something it's related to balance, but it's easily treatable. We just do like several maneuvers and it clears up really quickly. But it works a lot better if we get to it fast and
yeah,
not after someone's had it for like 2 years. So
yeah.
um yeah, really any type of dizziness, I would say also that
Okay,
definitely needs to be addressed either by us or a physician or both.
yeah.
So
Yeah.
mhm.
Yeah. And most of the physicians that would be good for that are like the ENTs that we've worked with, right? Or yeah, I mean those are the ones that we've seen a lot refer to us, but their PCP might, right?
It's interesting because yeah, I mean, I would like to get more referrals from PCPs because I think we're getting to the point where they're knowing now that they can just send them to someone who's certified, even
Yeah.
ENTs.
Yeah.
But it's actually, with specialists, it's kind of hard to get in. So
Yeah.
I kind of would like to get it
Yeah.
treated before we have to send someone to a specialist, even neurology or something like that.
Yeah.
So yeah.
Yeah.
Um, Actually, if you don't mind, I was gonna look because I was on a
And that's kind of
journal
my
club.
plan. That's kind of my plan with this is to like, I might send it to some people. So,
Oh
but
yeah,
yeah.
because I was at a journal club a couple weeks ago, and the average time that it takes. from the first symptom of dizziness or vertigo to a final diagnosis is 62.3 weeks.
Oh,
And
wow.
that's just the average time. So there's an article, it's regional differences in patient-reported outcomes as a proxy of healthcare practices for Americans living with vestibular symptoms. So yeah, usually people with dizziness see like three, a couple, at least a couple different specialists. That's what I hear all the time. And so it's like once you're seeing a couple different specialists, that's a lot of time. And
Mhm.
then that's just a lot of time that you're not getting help. And so, if we're not getting as much help, that can, delay outcomes too. So
Awesome. Well, not awesome, but interesting. Yeah, it's very interesting.
yeah, yeah, for sure.
Yeah. I would say another thing that makes you different, that maybe I want to talk about a little bit too, is you used to work in a traditional PT clinic, but you now have decided to go mobile with me. And then I think you're kind of doing some of your own thing as well. Kind of what
Mhm.
made you decide to do that? And like, what does that look like to work with you on a mobile basis?
I honestly, I needed the flexibility. I
Hmm.
now have two small children, so it just really works a lot better for my schedule and for my husband's schedule.
Hmm.
And then I really like being one-on-one with people.
Yeah.
I think that helps us achieve people's
Yeah.
goals a lot faster because I get to know people a lot faster and
Hmm.
we kind of are in sync with each other a lot faster. So,
Yeah.
if I have a lot more time to just observe and
Yeah.
adjust, and, documentation doesn't take that long. So it's just a better fit for me.
Yeah. Yeah. And it sounds like even the patient too, because I know sometimes in P other PT clinics, there's double bookings because of insurance and all that stuff, which we take insurance as well. But we do limit a lot of the insurances we take so that we can get you that one-on-one care with some of our patients, which is what's kind of different about us. Yeah, so that's something that's different. Yeah, so
And
what,
especially,
go ahead. No,
oh,
go ahead.
sorry.
No, go
Oh,
ahead.
yeah, especially with this population, it does tend to be a little bit more involved. So
Hmm.
I was, when I treated this population in the past, it's hard to do something in, a short visit or a double booking visit.
Hmm.
So it's just really helpful to have a good chunk of time to really get a lot of information from the get-go.
Yeah. Oh, yeah, I agree. So what does recovery look like for some of your vestibular patients? Like, what's a typical, I guess, plan of care, and what do you kind of do, I guess? What does that look like?
It depends on what the patient's coming in for.
Yeah.
Because yeah, there's some dizziness diagnoses that are really quick.
Hmm.
We just do like some repositioning maneuvers, but then there are other conditions that can take a while longer because it's more
Hmm.
like retraining the system or balance, which takes a while. And sometimes people have other musculoskeletal pain or weakness that we have to address too. But yeah, I think, just a good evaluation and just kind of give people an estimate of how long it's going to take and just make sure that they're on board with that because, if we have a lot of delays, if patients are, not consistent, that can kind of
Hmm.
delay things quite a bit. So
Or if they
yeah,
have multiple factors, kind of like what you said, like they have musculoskeletal issues, so they're weak, or they have
yeah,
balance issues, so it's like, hey, we're working on proprioception as well, or just the neuroplasticity of like the balance, and I think you mentioned just the type of diagnosis maybe they have, whether it's BPV or some other type of vestibular disorder. So it could be a bunch of factors too. So it could be short for someone who doesn't have as much factors, or it could be a long time. But it sounds like, it could be you just make it a personalized individual assessment on each one.
yeah, yeah. And I think, yeah, it's like I wouldn't want to tell people that it's going to be really fast, but it'll be the appropriate amount of time. That's the good thing about one-on-one is it's easier to estimate
Yeah.
how long it'll take.
Yeah. So let me see what else questions I have here. Um, yeah, I guess we went over most of this. Maybe you can summarize it just in case people haven't gotten it. But what's something that most people don't know about vestibular? that maybe you would want to communicate? I think one thing I heard was that like it could be anyone that has it, and it could be,
Mhm.
you know, aging, but like what would you say just to kind of summarize that maybe what people don't know? Yeah.
Yeah, I mean, I think it would just be, the age ranges where people need to look out for it the most because um, I think a lot of the difficulty people have with falls and with
Hmm.
aging, it's just something we can help people with a lot better, a lot faster.
Hmm.
Um, and yeah, I'm hoping that people, they're not just thinking they're getting old as
Hmm.
much. Because yeah, we definitely need to um, incorporate physical therapy a lot faster,
Yeah.
especially vestibular rehab, because there's a lot of good information that supports it now.
Yeah.
I think that might have been a little bit of the delay. It just took a little bit for us to do the research and kind of get good results, but now we have it. So we've got good treatment for dizziness and balance. And yeah.
Awesome, awesome. And then my last question, which I might help you answer because you work for me, as says, do you have any type of special you want to promote? And so I guess the special with you that we're kind of marketing right now is so normally to see you one-on-one, we charge $250 for an evaluation. And so if you're seeing this podcast now, our specials could change. So what I would say is just message us about any specials that are going on. And it really just depends on kind of Laura's availability, the kind of specials that we're running. But yeah, and you'll get an evaluation with Laura. And like I said, she services the McKinney Allen area. McKinney Allen, Anna,
Melissa,
yeah,
Anna, yeah.
Melissa. So just depending if you're in her zip code, she would be able to service you. And so yeah, just message us and we'll kind of talk through that. So that would be the special that we have going on. Just message us really. Let's see what other questions I got here. Yeah, I guess you've worked with a range of patients, it sounds like, but like which one would be your favorite? Like what type of patient? What's your ideal, like, oh, I love working with these patients. You know, like for me, I like working with shoulders. And so, when somebody comes in with like, super spinatus dysfunction, like, and I know they've been to other PTs already, and I know they've tried many things, and I'm like, I've seen this so many times. I know what I'm going to do because like shoulder pain can present so differently depending on which tendons involved, or what muscle weakness is involved, or what joint dysfunction. But like when they have that specific one, I'm like, I know I'm going to be able to help this person, and so it gets me excited, right? So is there
Hmm.
something like that that maybe you think of with the patients that you work with?
Really the patients who I've seen with you, just the general, they have trouble with balance, they know they need to get better.
Yeah.
I like trying to find out what's going on because it can
Hmm.
be so many things. And
Yeah.
then a lot of times they have other, functional issues that they're having trouble with, like getting up from the ground or from a chair. They might have other pain. So just kind of getting all those issues addressed.
Yeah.
Yeah, that's very rewarding for me.
Yeah. So you like a good challenge.
Yeah, yeah. A challenge where we're both on the same page about, this will take a while, but they're, willing to go on the journey with me and kind of go through the process.
Yeah.
So, yeah.
Well, awesome, Laura. I don't have any more questions for you. This is awesome to do. You've been working for me a while, so I want to get some marketing out for you. So I look forward to people hearing this because you are an exceptional therapist. So thank you for your time. And I know, you have limited time because you have your kids and, we found a slot today that works. So
Yeah, this
um,
worked out well.
yeah, yeah. Well, awesome. Anything else you want to
Yeah,
say, or are we all good?
I think that's it.
Okay, well, let me stop this recording. And thank you everybody for listening. All right.